Occupational therapy is like physical therapy in the sense that it's a rehabilitation science. However, occupational therapy is focused on taking whatever you need to do and using that therapeutically to help you get back to doing that very thing.
Occupational therapy helps you do real life things. So who cares if you can walk 50 feet if you can't tie your shoes, pull up your pants, or put on a shirt to go through your day?
Doctors may save your life, but occupational therapists make your life worth living.
So different schools are going to require different things, but to get into OT school, some classes that you're probably going to have to take are anatomy and physiology, statistics, human growth and development, and sociology.
Every school requires different amount of volunteer hours to get into their programs. However, here at MUSC we require 30 volunteer hours to get into this program. Obviously, it's best to vary these settings as much as possible to get the most experience before getting into school.
Once you get into the program, you're not really able to do much shadowing to feel out the different areas within occupational therapy. So it'd be best to get a variety of hours in different settings before you get into school.
You're also going to have to take the GRE, so study up. At MUSC, we want to try to see scores in the 50th percentile or above.
So what does an OT look like? First, they're empathetic, they're patient, they're hardworking.
Adaptable, creative, and frugal, personable, and outgoing.
Should be an effective communicator, have good listening skills, good organizational skills, and good problem solving skills.
You've also got to have a desire to help others, you've got to be a good team player, and you've got to have the medical knowledge and background to be able to evaluate and treat patients.
So what's the main difference between an occupational therapist and an occupational therapy assistant? Well, the biggest difference is the amount of education that you need. A CODA, or an occupational therapy assistant, is going to need either an associate's degree or a bachelor's degree. An occupational therapist is going to need to get an additional degree, either a master's or a doctorate.
So the main difference between an OT and an OT assistant in the clinic is that an OT assistant mainly does treatment with supervision, while an OT does evaluations and discharges patients on top of that.
The average annual salary for an OT is $75,000, while the average annual salary for an OT assistant is $50,000.
So occupational therapy helps you find a job, right?
No, OTs do not help you find a job. An OT will help you get back to doing your job, but it's vocational rehabilitation. What are they? I don't even know who does that, but it's not us.
What's the difference between a PT and an OT? PTs normally help with strengthening, mobility, and pain management, while OTs help with anything functional.
So that means different things for different patients. That could mean helping somebody learn how to dress themselves or cook a meal for themselves after a stroke, or it could mean somebody getting back to the community and seeing their friends or getting back to a job.
Great, so we talked into OT school. So what kind of classes are you going to have to take?
You're going to start out with general science classes, things like human anatomy, surface anatomy, neuroscience, and pathophysiology.
So human anatomy is going to break down the human body. Some programs will have a cadaver lab. We have one here at MUSC where we actually get to dissect the human body.
Surface anatomy teaches you how to find different body structures from the surface of the body. These include muscles, bones, and other things like ligaments and tendons.
Neuroscience teaches you about the central and peripheral nervous systems.
Pathophysiology teaches you about the disease process and what happens in injuries.
There's also a lot of courses that are OT specific, so you're going to get some about pediatrics, some about geriatrics for the older population, some about mental health, and some about musculoskeletal disorders.
Other classes you're going to have to take include theory, interprofessional education classes, and evidence-based practice. You need to know what you're doing and why you're doing it.
Multiple fieldwork experiences give you the opportunity to work with clients under the supervision of a clinician. That way you can begin to feel more comfortable with these interactions.
So you've graduated school, that's great, but there's a couple things you still need to do before you can get a job. First, you need to pass your national board exams. And secondly, you need to get licensed in the state in which you wish to work.
One of the best things about being an OT is there are tons of job opportunities, and if you get tired of what you're doing, at first you can always switch it up and do something else. So if you start off in pediatrics, you might be working in the school system, or you might be doing inpatient or outpatient with children. Or home health, you could also do home health with children, and you can do it with older people too.
You might see a patient in an acute care setting in a hospital or in an outpatient or inpatient clinic once they've left the hospital.
If you want to work with the elderly, you can work in an assisted living facility, a nursing facility, or in home health.
Other things you can do with OT include driver's rehab, animal assisted therapy, low vision, and prison system.
The Bureau of Labor and Statistics predicts a 29% employment growth in occupational therapy by the year 2022. In other words, the job outlook for occupational therapy is great.
So if you want to enter a service field that you get paid for and spend every day changing lives, then maybe OT's for you.
OT is so unique. Who else can say that they baked a cake with their patient today?
There's a lot of flexibility in occupational therapy. You can change your job without having to go back to school.
So if you want a job there, you feel like you're making a difference every day, then perhaps OT is for you.